Hello, everyone, and welcome to this audio podcast. This audio podcast as part of a Interlobular branch edition. This audio podcast as part of a SZtorm Communicade, an audio podcast as part of a Squadron G-Force, an audio podcast as part of a SZtorm Logistics production. In this audio podcast, a little bit in around the epidemiology around HSP or Henoch-Schönlein Purpura. So Henoch-Schönlein Purpura or HSP is perhaps one of the most common vasculitis vasculitis renal or kidney relating or renal relating conditions in young people or in children um, uh, in young people and peds or young adolescents, occurring in around 8 to 20.4 or 8 to 20.4 per 100,000 children per year. HSP usually occurs in children in children or young people between the ages of 2 years and 10 years of age, with 50% of all cases occurred in children or young people aged less than 6 years, and mostly in children or young people aged 4 to 6 years. Although it is generally a self-limiting condition, HSP can cause acute gastrointestinal manifestations, and or renal manifestation with varying indices. Age of onset is a suspect risk factor for renal manifestations in HSP. The etiology of HSP is sort of unknown to an extent, although a variety of antigens such as infections, vaccinations, drugs, foods, and insect bites can trigger the onset of HSP. The disease is characterized, or condition is characterized by deposits of immunoglobulin A, IgA, which contain immune complexes and complement components in small blood vessel walls. It is generally agreed, has been generally, there is a generally amongst the specialty, there is a consensus that the incidence of HSP decreases with age, and then the proportion of children the proportion of children or peds or young people presenting with renal involvement reported in studies varies from anything between 10 to 20%. The the There are no specific diagnostic. There are no specific diagnostic markers of HSP. If present, anemia is usually a result of gastrointestinal bleeding or associated with acute nephritis. Thrombocytosis is a feature that may be related to the severity to disease severity. Renal involvement results in hematuria with or without proteinuria, which may be in the nephrotic range. A rapidly progressive nephritis may result in renal insufficiency and requires histological assessment. Von Willebrand factor antigen is synthesized is synthesized and is present in endothelial cells. High concentrations have been detected in patients with HSP, as with other vasculitic diseases, probably because of the vascular endothelial damage. An association with disease activity has been noted This may be useful, may be a useful marker of disease severity. Soluble thrombomodulin is derived from damaged endothelium, which may 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 help distinguish may help identify endothelial and may help identify endothelial injury more specifically, and raised serum thrombomodulin concentrations have been demonstrated in patients with HSP nephritis. Routine coagulation investigations are normal, while factor 8 activity has been reported to be low, especially in patients with severe gastrointestinal disease. That draws this audio podcast to a close. This audio podcast as part of the Interlobular branch edition. This audio podcast as part of a SZtorm Communicade, an audio podcast as part of a Squadron G-Force, an audio podcast as part of a SZtorm Lipostics production.